I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to the IDD Health Matters podcast. We're coming to you from the American Academy of Developmental Medicine and Dentistry conference in Denver, Colorado. And we have a special guest today who is, I guess we could say, the poet of the conference, right? Yeah, so we have Amanda Harnnauth. Welcome, Amanda.
Thank you so much for having me, Dr. Craig. I'm excited to be here.
Well, I'm excited for us to talk together. So tell us who you are, Amanda.
My name is Amanda, as was stated before, and I am a poet, a Special Olympics athlete, just honestly a lover of life. I have several disabilities, including autism, hydrocephalus, vision impairment, retinopathy of prematurity, to be more specific, and just like I said, a lover of life, somebody just who embraces what I'm dealt and what I'm given. That's
clear and evident in who you are and the way you present yourself. So Special Olympics, let's start there. So tell us about what you do in Special Olympics.
Yeah, so when I first joined the Special Olympics in 2018, I began as an athlete. My sports were bocce ball and bowling. I wasn't good at either one of them. And it was pretty frustrating, but there was a woman who overheard me speaking to one of my coaches and automatically came over and said, "You need to be part of the athlete leadership program." And I had actually just had eye surgery, so I wasn't really paying attention, but it was my mom who really brought it to my attention. "Oh, you're going to join this class. You're going to be part of athlete leadership. They give speeches and training to those with intellectual disabilities within this organization." So I said, okay. It was a couple of months off, so I wasn't really I wasn't really thinking about it too much until I went through the training. It changed my life.
Really?
Yeah, changed my life. I now had the opportunity to lobby Congress. I've done that twice now. It was during the pandemic, so it got to be on Zoom.
Oh, no. Oh, well, you didn't get to go in person. But.
No, I didn't get to go in person, but they surprised me with a virtual visit from one of my favorite people, Chairman Tim Shriver.
Oh, nice.
And I was like, oh my gosh, this is really, really exciting. And he's also a fan of my poetry.
As many people are. And that's going to be a teaser. So later on, we're going to hear some of her poetry. So hang in there.
Yes.
All right. So Special Olympics advocate, teacher of, so what do you teach others about in Special Olympics?
I try to be very real with what it is I teach. And first of all, the one thing that I teach and try to stress is that Special Olympics, it's for everybody. It doesn't matter if you're a volunteer. It doesn't matter if you want to help run practice. It doesn't matter if you're an athlete. You can play multiple sports. Special Olympics is for everybody. So coaches, volunteers, siblings of those with intellectual disabilities. Special Olympics is for everybody.
And there's a health component to it called Healthy Athletes.
Yes.
Right? And there's an opportunity there for the athletes to participate in different types of medical and dental exams and maybe get some health needs met.
Yes. So funny story, I went to the Summer Games in 2019 and we went to, I believe it was called the Healthy Athletes Pavilion. Mm-hmm. So they did the screenings for us. So we got our feet checked. We had our hearing and mental health. That was fun. They gave us like these really cool like stress balls and we got to do like workouts with the police officers. But when it came to the vision station, so opening eyes, I skipped over that one. And the reason why I skipped, I love how you're looking at me.
I was wondering, why'd you skip that one?
So I skipped that one because I was born with retinopathy of prematurity. So my retina has detached, I believe, 3 times now. So I already knew that I require specialized care. So I figured...
And you were getting those needs addressed already.
Yeah, I was getting those needs addressed already. So I figured, let me, pass it on to the next person who really might need glasses. They do wonderful work to provide athletes with glasses. I have a friend who just received her glasses from healthy athletes, and she looks great in them.
Oh, that's wonderful. That's wonderful. So, Special Olympics, what other activities are you involved in?
Gosh, so I do Special Olympics. I don't consider public speaking a chore, so I really love just fishing around for like different podcasts.
And here we are.
Yeah. just fishing around just for like different podcasts. So I spend a lot of time on Google. Just let me apply to, or let me check out this autism podcast. Let me check out this podcast with developmental disabilities. Let me check out what's going on here. And one of the first podcasts I was supposed to be on for 2023 was The Human Perspective. That is Judy Human's podcast.
Yes.
We did the prep interview for it. She's flawless. You got to know that she's flawless. She's beautiful and she's wonderful.
Tell everybody about Judy.
Yeah. So Judy Human is known as the mother of disabilities. She is instrumental in the Americans with Disabilities Act and the 504 legislation. She is such a trailblazer just for not just her time, but just in history, because she refused to say that people with disabilities are going to be mistreated and we're going to we're going to accept it. She said the opposite. She said no. She said we're going to be included because we matter. I met her at a conference for the Center for Independent Living in Berkeley when I was in college, and we connected. We were friends for the past 8 years, and it's been wonderful.
I bet. And we lost Judy recently. Yeah. Big loss to the field.
That for me, I took it, really, really hard. Like, it was the first time I really felt like a physical weight just on my chest, and I was tired for a week, where I gave myself permission to just lay down and sleep. And unless it was really something necessary, like, bathing and eating, I spent time sleeping.
That's important that you recognize the weight of it, and that it's a challenge, and gave yourself the space to grieve and to work through it, because those are normal responses when we lose people that we care about and that we love. So that there's nothing wrong with that response. That was a good thing that you did for yourself, it sounds like.
Yeah. I had, a hard time getting back to, what other interviews am I looking forward to? Am I going to, continue to go on Google and look for other podcasts? Because this was really something I was looking extremely, extremely forward to. She emailed me earlier this year and said, we have to have you on.
Yeah.
Because I was really, really looking forward to it. She offered to write the foreword for my upcoming book, which is unnamed.
Okay. All right. That's a great segue. What's the book about?
Yeah. So I am a poet, and poetry is something that I discovered when I found out in 2016 that I have autism spectrum disorder, and I spent a couple of weeks, months sobbing and crying and trying to just figure my life out, figure out who I was. And autism changed my life for the better. And I know that's not something that many people say because they see it as a hindrance instead of a help.
So the poetry kind of resulted from figuring life out? Or did it help you figure life out?
Yeah, it gave me permission to be myself, just as the autism did. And I think that the autism as well as the poetry go hand in hand. It's kind of like a love language that's intertwined that I had to break open. And I love them both equally, even though they can both be challenging and difficult. There are times where I'm sitting there with pen and paper. I have no idea what to say. There are days where I'm dealing with autism and I'm like, ugh.
So where have you had the opportunity to share your poetry? I know you've shared it here at the conference.
Yes.
Where else?
I've also shared it at Stanford. I've shared it in a variety of magazines, Worldwide Coaching Magazine. They're out of Canada. Where else have I shared it? I've also been highlighted in, so many places. It's really, really hard to.
No worries. You were also, or you're about to also get it in Australia from a conversation we just had earlier with Dr. Troller.
Yeah. So Australia is one of the places that I wanted to definitely pinpoint. Got the opportunity to visit Sydney, Australia in 2004 with my family. We visited the Sydney Opera House, and I just thought it was so wonderful. And fun fact, one of my favorite boy bands when I was in high school were the Jonas Brothers. And they actually have a song called Australia. So I was very, very excited when the song came out in 2007. I was like, I went to Australia. This is fun.
So one of the things that I like to talk about on the program are things that can impact health and wellness for people with intellectual and developmental disabilities. And you mentioned you've had some eye troubles and a few other things that you've had to deal with. So you probably have had a number of interactions with healthcare providers in your life. And if you had a word of wisdom that you could share with healthcare providers, what would you tell them to do?
First of all, treat us as individuals. Treat us as human because we're human. We're here. We matter, and we care about others. But if we are not given adequate health care, we can't be here to contribute to this world, and we can no longer express our gifts with the rest of the world.
Yeah, and so see people as people first.
Perfect.
Yeah. So sometimes there are communication difficulties with healthcare providers and patients that they're supporting. Do you have any words of wisdom or advice about ways to improve that?
Yes. Healthcare providers need to be open to the fact that there are several different ways to communicate with various disabilities, such as if the person is deaf, maybe call in somebody who knows sign language. If the person is vision impaired like I am, perhaps enlarge the forms. If the person is unable to read, perhaps have really detailed pictures. We all want to be able to be active in our healthcare, and these are some of the ways that's going to allow us to be active.
Yeah. Have you had experiences where you're receiving healthcare and you're in a healthcare setting and someone's with you and the clinician speaks to the other person more than they speak to you?
I imagine that I have, but I imagine that was probably in my younger years, and at that time I was dealing severely with hydrocephalus, so I was unable to really answer certain questions for myself. So having parents and, an older sister there to be my advocate at the time was at that time incredibly helpful.
Great. So parents, I'm sure they've been very influential in who you are. And I heard you say this earlier, and I think this is some fantastic advice. for everyone out there. What was the thing you mentioned earlier when we were talking that your mom told you?
Oh, yeah. She said, dress to the nines, she called it. Dress your ass off. And, don't really care about what everybody else thinks. I mean, just because you have a disability doesn't mean that you can't look good.
And you do.
Thank you.
You do it. You do great with that. So one of the things that I like to do on this program, I call it 3 in 3. So 3 little pieces of advice, words of wisdom, just personal stories, or again, just something you want to share with people out there in 3 minutes. So 3 things that you can talk about, that you can tell people about, that you think could improve the world of supports and services for everyone, including people with intellectual and developmental disabilities.
Can we just start with kindness? I think that can, be like 3 things in itself, because it's so big. Because we need to start with kindness. We need to be kind to each other. We need to, not just people with disabilities, but people of various ethnicities and folks who deal or identify as a different gender. Kindness.
Kindness.
Hello.
It's that simple, isn't it?
Yes.
Yeah.
Kindness and respect.
And respect.
Respect for all people.
Yep. And valuing the lives of others.
Absolutely.
Yep. So it's poetry time. Do you have something that you can share with us?
I do.
All right. I'm looking forward to hearing it.
Okay, this one's new.
Oh, great.
Yeah. So this one's new. This one is called Out of the Box. Out of the box. You can say that I'm out of the box, and I am different by design. I do things that wouldn't be aligned with the average. Who am I? I am me. That's just been so hard to claim victory. Victory over my shortcomings. Then I was told what I would never be. I take pride in my differences. It makes me stand out. One day, others will scream, "She dared to be different." Let's all scream and shout. I want to pave the way for those who are different. I welcome them with open arms. I'm out of the box. I refuse to be ignored. I am going to stand proud. I'm out of the box. I will continue to push my way through the crowd. Out of the box. Yes, that's me. That's who I am, Amanda. Yes.
That's amazing. And you're definitely out of the box. There's no doubt. You're
Thank you.
You embrace life. It's so clear, the passion that you have for this, for life is very clear, and it's wonderful to have you on the program. Thank you so much for taking the time to talk with me today, and thank you for what you do in this world.
Thank you. I appreciate it.